covering the northern Bahamas? You're watching the Bahamas Tonight, Northern Edition.
Welcome back. As we are now in the peak of the 2018 Atlantic hurricane season, a facility that cares for the island's precious pearls is making an urgent appeal. Sabrina Brown reports.
The Grand Bahama Home for the Aged has been caring for the elderly for almost 3 decades. And while founder Agatha Thompson says she is grateful to the community for their continued support, she says they are once again in need of financial assistance, as repairs to the facility have not been fully completed since the passing of Hurricane Matthew in 2016.
So we have weathered every storm for leading up to 30 years in the building. We never had to go to a hurricane shelter or send the residents home. But the last hurricane, Hurricane Matthew, really did give us a beating, and the building suffered a lot of damages. However, we had insurance, which paid a portion of it. And so we still are in the middle of another hurricane season, and our roof still need to be repaired.
Thompson says most of the damage was done to the rear of the building, and it will cost around $12,000 to complete those repairs.
The Rotary Club in 204 donated the metal roof, and that have kept us safe through all the hurricanes leading up to Matthew. Matthew took off the entire rear of the building, our laundry room, our sitting area, and a half of the metal roof. Now, if you're passing and looking at the building, it looks like it's in perfect condition. We repaired the roof, but the metal needs to be put on because it adjoins to the metal that was left there. So we're asking for assistance with having that made safe and secured so we can weather many other storms in that building.
The seniors' home currently houses some 20 full-time residents, but Thompson says the home has been a safe haven to many others, particularly during the hurricane season.
We also have persons that come to the home after a hurricane, and their places have been damaged. As a matter of fact, we still have a few that came in from West End and the outlying settlements that their homes were damaged, and they're still with us. A few were able to go back to their homes, but a few are still there with us.
Thompson says the home is also in need of shutters and a generator. Sabrina Brown, ZNS Network News.
In partnership with Ocean Conservancy, the Ministry of Tourism is asking citizens to suit up to clean up for the 33rd International Coastal Cleanup this Saturday, September 15th. Last year, Grand Bahama volunteers collected nearly 4,200 pounds of trash from local beaches, and the cleanup committee is hoping for even more volunteers to step in this year.
Since 1986, the Ministry of Tourism has been coordinating this event, and every year we focus on using the schools to assist us in collecting much needed data, which will be gathered at the end of this project and sent to Washington, D.C., where it will be used to determine some very key factors. One is the level of pollution on the shoreline, namely plastic, styrofoam and the like. We have about 15 coordinators from a cross-section of the island. 2 of those coordinators are present with us this morning, and they are going to be responsible for taking those data and bring them into our office so we can compile that information and send them back to Washington, D.C.
Well, the Bahamas National Trust is a key player in the exercise this year.
Because you're not a part of the tourism product doesn't mean that you're not a part of sustainability. All of us have a viable option in how this island operates, because any job loss is a job loss for all of us.
The good things about this initiative is that the items that are collected are actually recorded so that we know whether they're plastics or whatever type of material they are, and hopefully that will allow us to be able to target where these items are coming from so that we can make some change to why this is happening.
The annual Us 2 Health Clinic held over the weekend at the Paris Plaza. Hundreds of men from the community attending the clinic to take advantage of the screenings. On island for the occasion were a number of doctors to assist and ensure a smooth process. This year, Dr. Camille Reagan, Associate Professor at the Cancer Prevention and Control Program out of Philadelphia, says that this year they were also conducting special research.
We're working as a team to try to address prostate cancer in the Bahamas, trying to understand what genetic factors might be related to the development of the disease. So we're actually collecting saliva samples from the men, both men with prostate cancer and also men without prostate cancer. And we're going to be doing some testing to try to see if we can analyze and come up with some answers.
Dr. Reagan leads a research consortium in the Caribbean called the African Caribbean Cancer Consortium. She says in this region, prostate cancer remains a top killer.
In the Caribbean, prostate cancer is one of the leading causes of death for men in our region. So it's a very, very serious problem. So having these men come out to screen is very important. And then also being able to participate in these research studies is also just as important, so that we can really try to find some answers to address prevention.
And finally, in news this evening, it is an ailment that appears to be quite prevalent among men in the Bahamas. Tonight, a local doctor talks about the warning signs and how it can be treated. Italia Hall reports.
Gout is an inflammatory condition due to elevated uric acid levels in the blood, which causes inflammation in the joints. Dr. Marcus Bethel says most often it is the big toe that becomes inflamed.
The joint in the big toe gets swollen, red, and hot. And it happens rather suddenly, usually overnight. It suddenly comes on. And that swelling and inflammation is due to uric acid crystals. In other words, the acid in the blood precipitates microscopic crystals into the joint that gets inflamed.
He says gout can be caused by several factors.
One, there may be an inheritance factor. In other words, it may run in families. But also there are environmental factors, such as eating lots of meat, alcohol. These are some of the common precipitating or factors that help to elevate the acid and cause precipitation of crystals into the joints. The joint, as I say, it can be any joint in the body. Usually it's the big toe, but it can be the ankles, the knees, the hip, the elbows, the fingers.
But there are some measures that one can take.
So you must stay hydrated. You should lose weight. We ask you to reduce the intake of red meat, meats generally, but particularly red meat, and of course alcohol consumption, particularly beers. They have a precipitating effect for crystals into the joints. In addition to that, individuals can be affected by damage to the kidneys, because kidney stones can form. In other words, the same crystals that precipitate in the joint can develop in the kidneys and damage the kidneys or cause kidney stones.
If persons feel the related symptoms, a doctor can check the level of uric acid in the blood and prescribe medication that can control the uric acid level in the blood, pain, and swelling. The doctor says gout usually affects men more than women in their 40s and 50s.
Adjustments in the diet are what's important, and understanding that you can help yourself by making some lifestyle adjustments. This is a lifestyle disease largely, except in those cases where it's an inherited disease.
Italia Hall, ZNS Network News.
And that's a look at stories making news this evening. Now it is time to Ask the Doctor.
Dr. Monique Pratt, welcome. Continuing our discussion on medical emergencies, many people don't feel confident that they know when someone around them is having a medical emergency. There are several basics that we can use to identify if there's a true medical emergency, and the patient should be transported to an emergency room as soon as possible. Usually this means calling 911 if someone is having bleeding that won't stop, breathing problems such as shortness of breath, change in mental status such as unusual behavior, confusion, difficulty staying awake or consciousness, chest pain, choking, coughing up or vomiting blood, fainting or loss of consciousness, feelings of committing suicide or murder, head or spine injury, sudden injury due to a motor vehicle accident, burns or smoke inhalation, near drowning, deep or large wound, sudden severe pain anywhere in the body, sudden dizziness, weakness or change in vision, swallowing a poisonous substance, or upper abdominal pain or pressure. If you are present when someone experiences any of these conditions, this is a medical emergency, and emergency medical treatment is needed right away. I'm Dr. Monique Pratt, and this has been Ask the Doctor.
Don't go away. A check on sports is up next with Ramiko Knowles.